Thank you for listening to Pierce Clinic Stories, the program where we hear testimonial stories from the patients of the Pierce Clinic of Chiropractic in St. Petersburg, Florida. The doctors of the Pierce Clinic of Chiropractic are experts in the upper cervical area of the spine, and today I'm here with Dr. Nick Shar, and he has a very interesting story of a patient who initially came in with one condition and discovered that an atlas correction affected an even more serious condition. Hello, Dr. Nick.
Well, good evening, Dr. Paul. Thank you very much for inviting me to share this story. I'm very excited to give some more information about the lady you were discussing there. She came to us about 2 days after having jumped on a trampoline and then experienced some extreme low back pain. She actually was carried by an ambulance to the ER for treatment, where they discovered that she had an annular tear on the disc. The discs are just the fibrous material that hold the bones of the spine together and give us some cushion. That disc had had some injury from the trampoline, and she had sought some care at the hospital. So after they were able to really not help her much at the hospital, besides giving her some muscle relaxers and some painkillers, she was referred by a friend over to the Pierce Clinic. And so she came in for a checkup, and before we did the examination, we got her complete history and found out that she had had some previous neck injuries and some previous low back problems, but never anything of this severity. And so after we got her complete history, we went to the exam room and checked her spine out to see why this low back had damaged so severely just from jumping on a trampoline. Something so simple, you wouldn't really expect that she would have such a dramatic and drastic result.
Right.
So as we examined her spine, we found that the muscles in her low back were actually very spasmed on one side. Actually, it was the left side more than the right, and that was causing her spine to actually twist and put some pressure on one side of the disc more than the other, which allowed the disc to damage much more readily from something very simple like jumping on the trampoline. It was actually causing her leg to pull up 5/8 of an inch, which is a little bit more than half an inch. That's quite a bit if you pull out the ruler. And so what we went about doing was finding out why those muscles were so spasmed on one side. They shouldn't function that way, obviously. And when we examined her further, we found that actually the very top bone in her neck was putting pressure on the nerves that were communicating from the brain to those muscles, causing them to malfunction and then create that situation where she had the spasms that were twisting her spine. Now, because the problem was in the upper cervical area, we obviously had to get three-dimensional x-rays so we could see exactly how it was out of place. And when we took those x-rays, we found that the very top bone in her neck was locked in a forward position on the right, where it was shifting up underneath the skull on that same side. Her neck was shifting off to the left quite significantly, and the second bone was also rotated quite a ways as well. So we actually had to work on both the top bone, which is called the atlas, and the second bone, which is called the axis. They were both rotated out of place and shifting in a way that was putting stress on her brainstem. Now, once we made the first correction for her, she was very skeptical. She is a pediatrician. I forgot to mention that. She's a pediatrician, so coming from a medical background, she was skeptical about trying chiropractic in the first place. And when, of course, we made the adjustment with a percussion wave, she was even more skeptical because we didn't lay a hand on her as far as twisting or popping her neck, or her low back for that matter. However, after her first adjustment, she started to notice some relaxation in those muscles in her low back immediately. And from that point forward, over the course of the next couple of weeks, she noticed some very significant improvement in her low back and how well she was able to heal up, considering the pain and the suffering that she had been through. Now, after we had made that initial correction, we took post x-rays, and she had showed a very great reduction, a very great response to the adjustment that we had made. The misalignment reduced pretty close to 50% just from that very first correction, which was a very good sign. And we made a few additional corrections over the course of the first month, and then she held her adjustment for 3 months, 2 to 3 months there. And over the course of that time frame, she just continued to improve with her low back. And about the I would say between 8 and 12 weeks of care, she came to me with a concern. She said, Dr. Nick, I've been getting these heart palpitations. My heart's been racing, and I don't really know what's causing it. Do you have any ideas? Could what you have been doing as far as getting my upper neck corrected and stabilized, could that be causing my heart to race? And I said, well, I don't know exactly what's causing your heart to race, but surely, something we could have done, freeing up the nerve system and allowing it to change to a different function, could have changed some things through there and allowed your heart to work in a different way. Why don't you go to your medical doctor and get it checked out and see what they have to say? And so she went to her general practitioner and got it checked out. She did some blood work, a full workup on her, and found out that the EKG was normal. All the other heart tests were normal. However, her thyroid hormone was high, and of course, with a high thyroid hormone level, you can have the heart racing. And so her general practitioner told her, of course, that your thyroid is overactive, and that's what's causing you to have the heart palpitations. Well, the pediatrician, my patient, looked at her general practitioner and said, well, that's impossible because I've had an underactive thyroid for years, and I'm on medication to make sure that hormone level's raised. And it's at that point that it hit her that her body was actually functioning better. Her thyroid was working now instead of underactive. And so she didn't need the amount of medication that she had, and it was actually creating a problem for her to be on that medication. So it was very exciting for both of us. When she came back and told me, I thought, well, that's to be expected. That's the way the body is. You get the interference out of the way, and the body does the healing. You never know how far-reaching that healing is going to go to something that may have been malfunctioning for 20 years. So it was very exciting to go experience that with her. And she's been under care ever since, making sure that she stays in good alignment to keep her spine healthy, and also to keep all the other organ systems working right, because she understands the depth of the power of that innate ability of the body that God gave us. So
now, you alluded to the fact that medical doctors they don't always get along with chiropractors, and in particular, pediatricians, well, not pediatricians, but doctors in general, don't think that children ever have a reason to go to the chiropractor. Has this doctor's impression of children in chiropractic changed at all as a result of her experience with you?
Incredibly. She got her son started very soon after she started to experience changes with her low back. So that was before she even had the thyroid experience. She had already decided to get her son under care, and he's been under care also ever since. Now, she's kind of switched her practice role, but she's gotten started in practice once again, and is now actually referred one of her patients to the movie night that we have tonight. And so the father of one of her patients is sitting back and watching The Power of Upper Cervical right now.
Well, very good story, Dr. Nick Shar of the Pierce Clinic in St. Petersburg. Thank you very much. We'll talk to you next time.
Thank you, Paul. Appreciate it. Have a great night.
You too.